Good evening, friends. This is Dr. Chetna Jain, Director and Senior Consultant at the Cloud9 Hospital. We are back here today again with our own series of webinar. And today we are going to talk not on a pregnancy related subject, but on a very, very common topic, which all of you want to hear. And there's a lot of demand that, ma'am, please speak on this topic. So today we are going to talk on birth control pills, who should take, how to choose, when to take, when to stop, what are the benefits, what are the disadvantages. Now, what are the birth control pills? So these are hormonal pills which are taken along with the menstrual cycle. There are various kinds of birth control pills. There are essentially two kinds. One is an estrogen and progesterone combination, and second is a progesterone combination. Here, first thing I would like to bring to your notice is in India, unwanted 72, that is I pill, mini pill. These are something which are very rampantly used. People do not like to use a regular contraceptive, and after a failed protection, they just want to take an I pill without realizing that I pill has a very high failure rate and a very high rate of ectopic pregnancies. So please, I pill means an emergency pill. An emergency can happen only once in lifetime. Please do not make it a regular habit to take I pill or this pill, which what I have had people coming to OPD who have taken two or three I pills in the same cycle, or those who take two or three I pills every year. So this is not the right thing to do. I pill should never be taken. It should only be taken if some mistake happens sometimes, which is probably not more than once in lifetime, is forgivable. And that is also not recommended. So what is recommended is you have to use regular protection so that you don't conceive. Now, so there are various methods of contraception. So today we are not going to go into the details of the rest of the methods. Today we are going to focus only on birth control pills. So birth control pills are essentially of two kinds. One is a combination pill and other is a progesterone only pill. So combination pill contains estrogen and progesterone. They come in various varieties. One is a fixed dose estrogen progesterone and other is a varied dose estrogen progesterone. We will not talk about the varied dose because it doesn't improve the safety or the success. So we will talk about the commonly used contraceptive pills. So these pills can come into various packages, which could be 21 days, 24 days, or 28 days. And they have different instructions to be taken from day one of period, or from day three period, or from day five of the period. Then there are certain other pills which are used to treat polycystic ovaries, control acne, and they are also given to women who have high levels of testosterone. These are a part of hormonal disorder, and they are also different than the regular contraceptive pills, and we are not going to discuss that. So now let's focus on the regular pills. So we were talking about estrogen and progesterone combination pills. So typically they are started on day 4 of the periods, to be taken same time every day. You can't miss. If you take the tablet half an hour here and there's a possibility of spotting. Now, who all can take? So, all can take except these people. So, who are these people? So, somebody who's over 35, obese, somebody who's having high blood pressure, stroke, a history of breast cancer, liver disease, gallbladder disease, uncontrolled blood pressure, high cholesterol. So, these are the women who should not be taking it. Breastfeeding mothers cannot take it, but the others who are also on bed rest, who are taking TB drug, who are taking medicines to control their epilepsy should also not be taking. And mind it, women who have diarrhea or vomiting repeatedly should not be taking it because that will reduce the efficacy of these drugs. So barring these women, the rest can take. Now, what are the benefits? The benefits are this is something which gives near good control on conception. That means this is one of the best contraception available. The failure rate is 1 in 400 if it is taken properly. The other advantages are it reduces the bleeding, so it is good for women who have heavy periods. It reduces menstrual cramps, so reduces painful periods, reduces breast tenderness, that is premenstrual syndrome, and their symptoms. It gives you predictable cycles. So suppose you're traveling somewhere, you can actually adjust so that you can travel, or if you have any puja or any function, so you can adjust your cycle accordingly. You do not need to remember it at the time of intimacy. So these are all the advantages. So if so many advantages, then there could be some disadvantages also. So yes, there are a few. One is that if you forget any pill, you may start spotting, it becomes ineffective, and you may conceive. It doesn't give any protection against sexually transmitted infection. And then it can alter the blood pressure, cholesterol. It can lead to stroke. It can lead to some marginal weight gain. It cannot be taken by women who have migraine. So, so these are some limiting things where there could be problem. But otherwise, the these pills are a wonderful thing. Then you have a progesterone only pill. Now, progesterone only pill has its own recommendation. It can be taken by women who cannot take estrogen for health reasons. And then there are women who are breastfeeding, they can also take it. The failure rate is high. There could be irregular bleeding in between, and it works by thinning the lining of the uterus. It makes the cervical mucus thick. It doesn't prevent ovulation. The combined pill, which we were talking earlier, prevents ovulation. So there's a difference between the mechanism in the two. And uh, if there is no contraindication, a combined pill is superior. However, in women who are more than 35, who smoke, who are overweight, who are hypertensive, who are breastfeeding, or who have any other similar history, then they should be not be taking estrogen, and they can have a progesterone only pill. But then we can also have they can also use alternate methods of contraception and not use these pills. So we talked then what is the difference between a 21 days regime, a 24 days regime, and a 28 days regime? So there's no difference in the efficacy. There's another one 90-day cycle also. So that gives you like every 12 days you get, every 12 weeks you take the medicine, and then there's 1 week break, and after that you get your period. So it's a 90-day cycle in all. So that can also be taken, but majority of the women are unhappy not having periods monthly, and they would want to have their periods every month. So in this scenario, a regular contraceptive pill, a combined contraceptive pill. Now they also have various kinds of progesterone, and depending on the patient profile, if somebody is having obesity or there's a history of clots in the legs or clots in the lungs or similar, then accordingly we can choose the medicine and decide whether this woman is fit to take this or no. So before going to the doctor, you can jot down certain answers. You should know what is your age, weight, do you smoke, if you have any history of clots in the legs, are you if the woman is bedridden for a longer time, liver disease, gallbladder disease, breast cancer, any history of stroke, hypertension, cholesterol, a family history of breast cancer. So all this will be asked into. So you have to know all this. Probably you write all this in a piece of paper before you go to a doctor and discuss the things into detail. And then doctor will take out that which is the best method of contraception, or which is the best pill for you, which you can take. Typically, pills should be taken till the age of 35, and beyond that, other methods of contraception should be used. As you understand, the fertility goes a little less beyond 35, and other methods become effective. But when the sexual life starts at around 20, at the time the fertility is very very high, and contraceptive pills are the best option to be used. That will give a very very predictable performance and a very small chance of failure. But in spite of taking contraceptive pill, if somebody misses the period, one has to do a pregnancy test to be absolutely sure that there's no pregnancy. And in case a pregnancy has happened and the woman wants to continue the pregnancy, uh, in majority of the instances, this pregnancy can be continued. It is safe to be continued. But obviously, somebody who's taking contraceptive pills would not want to have a pregnancy. In case somebody is not married and very sure that they cannot conceive, or they would never want a pregnancy before they settle with a partner, they should use double protection in terms of contraceptive pills along with a barrier method, that's a condom, to prevent pregnancy, so and also to prevent STIs. So if you have any questions related to this presentation, you can tell now. I hope I'm clear enough, and I hope you understand the myths around contraceptive pills. It is safe for majority, barring the very few that we talked about. Not all women have these complications, but there's a lot of myth. Okay, one more myth that I want to tell you is a lot of women come and ask me that whether taking contraceptive pills will affect future fertility. It is certainly, it doesn't affect any fertility in future. So that means when you take the pills, it prevents fertility uh, till the time you take it. The day you stop it, the next day you're fertile. That means the next cycle you can conceive and have baby. It has no after effects. It has no teratogenicity, no fetal effects, and it has no interference with conception. It has no long-term impact. So there is no fear of any future plans. So it is unlike what you hear in the family that if you take pills later on, you don't conceive. See, these things these myths came into work because what happened was women took pills and delayed their pregnancies for a very later age, and then they had age-related decline, and not because of the pill-related decline, and then the pill was blamed for it. So it is recommended that once you get married, you put your fertility plans, visit your doctor, know your fertility levels, and then decide when you want to have a baby. Until then, you can use these pills. If you have any questions, do let me know. So there is a question here. I'll just enlarge it and see which pill we consume instead of I pill. So it's a combined pill, so you get a lot of variety. Usually it is an estrogen progesterone combination. It depends on your body structure whether you need a 20 micrograms of estrogen or 30 micrograms of estrogen along with the progesterone. So we need to sit together and take out all the details and know what is your body type, what are your details, and then a pill can be recommended. So there are various generations: first generation, second generation, and third generation combined contraceptive pills. So one of those will be prescribed to you depending on your requirement and body types. So an evaluation needs to be done. It cannot be just offhand prescribed. But I pill certainly should not be taken because it is very dangerous to take that. Is there any disadvantage of birth control pill? Yes, the advantages we have spoken already, but disadvantages are like hypertension. Some women can develop hypertension or stroke, migraine, or weight gain may be marginal, but the weight gain cannot be more than 1 or 2 kilos. And there are certain pills which can actually lead to weight loss. Not all pills will lead to weight gain. So yes, there are certain, and if you forget one pill, there could be bleeding. So these are the disadvantages. You have to remember the pill every day. You cannot afford to miss any single tablet. So these are the disadvantages of the pill. Is there any side effect of complication of taking pill in future? So any side effect or complication of the pill will happen at the same time. That means whenever you're taking the pill, uh, there could be nausea, vomiting, headache, high blood pressure. Very rarely there could be stroke. In the longer run, there's a very marginal increase in certain diseases like breast cancer, but overall, there is no impact. And after stopping the pill in 5 years, the effect returns to normal. So, in all, contraceptive pills are the best method of contraception for a young couple who is looking for short term contraception of 1 or 2 years or 3 years before they are intending to plan a baby, or those women who are not married and sexually active, especially between 20 and 25 years. For them, a combined oral contraceptive pill is the best option because their chances of getting any disease is extremely low. However, if they're obese or having hypertension, this should needs to be looked into. And certainly there should not be any personal history of the diseases that we talked about. But in future, there is no long-term side effect. what pill should we consume instead of I pill? No, so as I told you, that this is individualized. Everybody needs a different thing. So in the market, you get maybe 30, 40 variety of pills. So it is not that one variety can fit all. So we need to see the person, ill person, and then decide after taking the history in detail which pill will suit them the best and prescribe them and make them aware of the benefits and the side effects. So it cannot be prescribed offhand on a public platform. Sorry about that. Thank you. Good day.